There have been almost twice as many overdose deaths in San Francisco during the pandemic than deaths from COVID-19. More than 1,200 people have died of overdoses since March of 2020. To talk about that rise, we are joined by Dr. Hillary Kunins, who oversees mental health and substance use care for the Department of Public Health in San Francisco. Dr. Kunins, thanks for joining us. You moved to San Francisco this past March. Why do you think overdoses have risen in San Francisco during the pandemic?
I will, sort of by way of answering, just acknowledge that this was really seen nationally. There have been multiple cities and places around the country that have reported similarly increases in overdose deaths, increases in other sort of indicators of substance use. And I think it's always hard to know exactly why, and what I think is speculated is that it's for multiple reasons, including the mental health impact of the pandemic, feeling isolated, feeling uncertain, feeling anxious, and using substances to sort of cope with all of that mental health impact of the pandemic. And I'll just also add one more thing, which is what's also clear in San Francisco, that the entry of fentanyl into the drug supply here has also clearly increased overdose deaths in San Francisco. And unlike some other cities in the East Coast and the Midwest, which saw earlier entrance of fentanyl, unfortunately, here in San Francisco, we saw the entrance of fentanyl a bit later in late 2018, 2019. And then, of course, the pandemic quickly followed. And so it's been really those two things happening in close succession, which has made 2020 really a tragically deadly year in terms of overdose.
Rightfully so. The pandemic has taken so much of our attention for almost 2 years now, but how striking is it to see much more overdose deaths?
So far, there have been more than 600 overdose deaths, and we believe that in 2021 there may be some fewer overdose deaths than in 2020, but they are not nonetheless at extraordinarily high numbers and rates. And it strikes many people. And for someone like myself, I'm an addiction medicine physician. I've been working on the overdose problem in New York and now here for a number of years. And certainly this is for us and for me and for the city of real primary concern and interest. And I think the Tenderloin announcement reflects that. The Tenderloin saw more than or nearly a quarter of overdose deaths in the city in 2020, and again in 2021 between the Tenderloin and the South of Market neighborhood.
We're on pace to have slightly fewer overdoses in the city this year compared to last year. Why do you think that is? Are there any strategies the city's using?
So while there may well be a few fewer, I do want to really emphasize that these are still at epidemic proportions. And as you know, these overdose deaths, we believe, are preventable. They are tragic loss of life, often in people's prime of their life. And they are among people who are, for whom many interventions can work. While we don't know exactly why there are fewer or potentially going to be fewer, we know that we have really been focused on this issue as a city. In this past year in particular, we have added new resources. We have, including starting up a new program called SORT, which you might be familiar with. This is the Street Opioid Response Team, in which community paramedics, along with members of the Department of Public Health street medicine team, respond to overdoses that are not fatal and offer an intervention or a package of interventions to these folks including referral into care, including naloxone, including connections to care for mental health or for housing, and then offer follow-up to these folks to continue to work with them to reduce their risk, increase their safety. Those teams launched in August. They are operating 7 days a week, and we will be adding on additional staff in the coming months, including peer people who with lived experience or peer workers who we know are particularly skillful at connecting with people in similar circumstances.
How does Mayor Breed's plan to declare a state of emergency at the Tenderloin fit in with what your team is trying to do?
Declaration of an emergency from a public health point of view does a couple of things. We are doing, have launched and will continue to launch a great number of interventions and services for people at risk of overdose. The declaration of emergency allows for easier coordination of services, ramping up services that we know work, and our ability to try new things as we see how our different interventions work as a city, and to be able to change course as we need.
Is our plan a step away from what the city has been focused on with harm reduction, mental health professionals, and non-police presence?
So the part of the strategy that we are responsible for on the public health side is to create spaces that people would like to be, and spaces that people can seek the kind of help that will reduce their risk of overdose. So I think and that is really our public health focus, and I think the focus of the declaration of emergency that Mayor Breed offered today. I think her words about creating dignity and continuing to offer compassion for people who are experiencing addiction or mental health concerns really, for us, is the focus as the public health agency. And it's clear that the administration is by this declaration is supporting that.
Could San Francisco try to employ a system similar to how Portugal deals with substance abuse issues, where they became the first country in the world to decriminalize all drugs, focus heavily on treatment and safe injection sites? It's been a stunning success with fewer people using drugs and fewer people dying from overdoses.
I mean, I think you're raising a lot of different issues that are really at the heart of what has been the United States' historic approach to working on the problem of addiction. And as you likely know, there is a number of legal frameworks at the federal level, at the state level, in addition to the local level, that have really shaped our country's response to drug use. I think. And those are some of the parameters that we continue as a city to exist in. And I think as a city, we have really are trying to employ every high impact public health intervention. And as you also know, the mayor and the city are looking to find ways to implement a safe consumption here in San Francisco, knowing that it is an effective part of a response to substance use, to addiction, and to overdose risk. And I know that work from a legal standpoint is ongoing.
Is it more of a federal issue or a state issue that inhibits your ability to put in some of those measures if you wanted to?
Part of the legal complexity in the United States does exist at the federal level, and because of federal laws that constrain some of the ways we can implement at a city, at a local level. Additionally, the legal framework in California and San Francisco, each, as you know, each jurisdiction has its own nuances. And again, I'm not a lawyer, that need to be worked through in order to implement these strategies safely.
Is there anything we missed with drug abuse you think is important to mention?
I think I want to convey the extent to which in public health we believe this is a reversible epidemic, and that we need to lead using science-based strategies such as the ones we've discussed, and also to remind, I guess, listeners that folks who are losing people they love and people are dying, and we can help save lives. We need, addiction is often stigmatized. People have a lot of shame. People lose their dignity because of that shame. And part of supporting people getting better is offering them the kind of care that can save lives and offering them dignity and respect. And I think some of that can be lost in all of the discussions about which treatment and when and what services and when. And underlying this, and this is me speaking as a physician, is a person whose life we can save and who has a hope for recovery, and we want to do everything we can do to help them get there.